My name is João Pinho. I'm Portuguese in origin, and I work for Fertility. It's the place that we do a lot of things, and I want to give a small presentation to you folks in terms of what to expect if you would come to us. And I know that everybody is trying to say very good things about them, and it's true. I think the difference here, if it's in the technique, it's a few differences in technique maybe from clinics, but I'm sure that all my colleagues are going to be able to take care of you. But we have a long-standing experience for about 20 years of doing this, myself across two countries, as I told this morning, and taking care of people in Europe, actually taking care of people more than in Europe. But it makes sense for you to have the option of at least having the choice of coming to our clinic. So this is our group, by the way. I'm sorry for the kind of distortion in the pictures that you might see. It looks a little bit better over here, but this is part of the community that you see over there. The most important people are the people with smiles on their faces, because those are the people that got their families through us. Some of them are workers, some of them have been there for quite some time. And please do come in. Oh, no problem. And the experience that I want you to have is in the final day, very simple. I want everybody to just have this smile on their faces, because it, for all purposes and intents, and you hear this again and again, is we are here for you. Yes, we provide a service. Yes, there is a compensation for that service, but it does only make sense that after being in school for 20 years and doing OBGYN across 2 continents, like I was saying, for me, it's the pleasure of doing this. I couldn't do anything else, and especially for the community that I serve, and that I'm part of that community in all senses. So surrogacy, it's a lot of parts. You've heard today that it can be from one part, which is the clinic, but there is the surrogacy part, there is the donor part, and I always start my consultations asking, what do you want to know about our clinic? And the questions usually are framed mostly in, let's start to how the process is. You choose a donor, or you choose a surrogate. It depends on what is the process, what is the agency, or even what is the clinic, and we'll talk a little bit more about it. But it's not easy, because if you choose a donor, you have to go through first the choice, then you have to make sure that the donor has all the qualifications that you want. You've been kind of fully informed of the characteristics of the donor. When is the donor going to be available? It's a lot of the questions that I have today, which is the donor going to be earlier or later, because we have our own schedule. And so these moving parts, which are going to be the IVF cycle itself, where the donor is undergoing stimulation, we have to retrieve those eggs, we have to make those eggs into embryos, and the collection of sperm and all of those things are done in our facility under one roof. So we have that possibility but you can choose the other way, which is you can choose the agency where you're going to go for your donors and you're going to go for your surrogates, and you're going to combine them together, and you're going to have a provider like us that is going to bind everything together, and we also do that. So next slide, and trying to figure out that, it was a busy slide, the previous one, but this is kind of usually the most important decision. What am I going to do? I know that the agency is maybe sometimes facilitates part of the choice, because you have a facility that tries to understand and bind everything together, but clinics also do that. And more so these days than previously, which the clinic would only do the medical part and very, very strict. And today we find that by us doing this almost 20 years in our clinic, is that by binding and combining, the experience is better for the patient. The smile doesn't come only because you get your pregnancy, but you construct this because it's seamless. Now, the there's an increased choice first for the clinic. And why? Because the clinic versus the agency is that you have the proximity of the donor. It would be one geographic location. You can argue also because it's the nucleus of all of this to happen. The pregnancy itself is produced and then transplanted and implanted in that facility. So everything is actually the nucleus and the center of all this process is going to be in the clinic. And it makes sense because of that. Now, can it be under the agency where we bind together? Yes. Sometimes it facilitates. I've seen, folks from places as far as the West Coast talking and asking around and asking, well, am I going to be able to do this from such a far place? And it's easy because boundaries over here are mostly limited by the legal aspects that each one of these components will be, which it will be the surrogate on one end and the donor on the other. And we work with that also around so that your life is facilitated. You get always the communication between us and the physician. So we are one of the, and I know that most of the folks are going to state their rates, and the rates that presented in SART, you should have this information already. If you don't, it's SART. The society puts up the numbers. They lag about 2 years along, but it's a good reference point for the clinics. I could tell you that we are in the top 10-ish fertility clinics in the country. Our rates are monitored by us every single year. Pregnancy rates always differ from year to year, as you'll see in the next slide. But we have mostly one other component, which is experience. You want to be in good hands. You want to relax through the choices that are going to be difficult, that you're going to have to make. And you want somebody that, or a group of people in this case, that are going to be guiding you through. And I can assure you that most of the places, even agencies that have an allocation only for all of this, we have a full staff, which is 20 people above and beyond. I think we're going to go and hit 30 or plus one day, which is only dedicated for this. We've been, Dr. Michael Doyle has been an advocate for a gay parenting rights for the very beginning. Has helped a lot of people along the way. And he has been maintained this steady growth that everybody tagged along, and all of a sudden it's booming because the environment also changes. But you want to make sure that you are in that right environment with the right hands. Diversity, we attend to every couple. It's not only gay parents that need surrogacy and need our services. There are many other causes for using a surrogate. The other aspect is that you want to make sure that you are in a place that they have produced consecutively and steadily the same outcome in terms of you getting happy and receiving a baby. For those amount, which is more than 5,000 babies have been born from across 30 countries. It's not only the US. We are so diverse in that aspect. Coming with me, I'm Portuguese. The origin is Europe, but we take everyone. And that is a good choice when people are sensitive also to your background. And that we try every single day. Now, I know that numbers are numbers. I don't want you to concentrate on this graph. This is not the most important information that I'm giving you. This facilitates just the fact that, yes, technology-wise, we're cutting edge. Yes, we have excellent pregnancy rates. We are in the top 12 in amongst a group of other people that are having big names. You can find links of this actually on our website so that you can, seamlessly know who are we comparing. I hate comparisons one-on-one, but we are. And so by having already that relief, you now can think about the next stage. Okay, I know that technology-wise they're good. I know that they've done this for a very long time. but is it going to be the facility either that I'm going to use as an all-in-one process, or is it going to be the one that would be the right match for me and for the agency that I'm using? So what I want here to express is everybody has different prices. I think we facilitate having lower prices because we have understood the population that we serve. We have consecutively known how to streamline all these processes, and thus keeping an embryology team, which is an outstanding team that have been there for years. All of that facilitates the costs being reduced for the end person, which is you, we're not going to get ourselves. This is a process that still is costly, and you want to reduce as much as possible. So the expertise and the cutting edge technology we already talked about in the in-house programs. So the other part is where usually folks would come to our table today and I would say, there's 3 booklets. I know that, start with that one, which is, if you want to have a light reading, which is all about, parenting and how you should go about. But one of the most often asked questions is, my first question is, how am I going to choose the donor? How am I going to represent all that I want of me by choosing the donor and with either or not with my partner and going in all of that. So having said that, we do, and I'll explain a little bit more quickly, which is we have a vast amount of accumulated experience in donation, so much so that we have one of the largest donation banks. And that's important because you want to make sure with certainty, with just assurance that you go through a list, and everybody actually can go through the list in our website. Now, you won't be able to see any pictures right now because that takes that small consultation. Even if you don't retain our services, you can do a consultation. We'll kind of walk you through that process. And then you'll have some limited information about the donors, but even the availability. We have things very, very well thought out. So if you want a donor in 3 months, you want a donor in 10 months. You want to make sure of 2 things. Is it going to be really available? Are these people going to be really steady on this and then there's not going to be any problems? Because it can be a scheduled nightmare, and this is mostly sometimes a scheduling nightmare. We can take that away also from you. One thing moving forward in all of this is we try always to communicate with patients. And you'll see that the first thing that I usually tell in my private consultations is, do you want to use FaceTime or do you want to use Skype? Because all of us have, even if you're living as I am living in Connecticut and you're living next door, life interrupted, we don't have any time, and we want to move fast, sometimes off hours, and you want to talk with somebody. That somebody is always there present. Either we will articulate very quickly, usually in the space of 24 hours, we'll be able to accommodate something or arrange something, communicate, so that quickly you have that information. Because this is going to be a process all about anxiety. You hear all not the prospective parents, but the parents that have gone through, and the first thing is, I remember the good moments. I tend to forget the bad moments. But right now, the process that you're starting, you're on a different margin, which is, I'm anxious about this. I'm already anxious before I start. Why, now I cannot take this idea. I have to go through this idea. That's why it took you to here. And we'll walk you through that. And I know that it seems like, just a normal sentence, but you getting all the information is important. I'm a kid from the 70s, and in the 70s to the 80s, everybody would say information is power. And for me, information is not power at all. Actually, is damaging as much as possible if you don't have the right information. So I've changed the sentence, and I keep on saying the same thing, which is the right information is power. And unfortunately, it's difficult to even understand because there are so many sources. I can be giving you the information, but next door, another person gives you a different information and you're confused and you don't know what to believe. And if it's on the internet, you know it's true. And it's not most times. Now, ethical practices are very important because people always want, the image is everyone wants to get into the bus first. And for that, sometimes some of the rules are broken, or some of the things that wouldn't be proper, they are overseen. And that can be damaging in the overall process. Reason being is simple. On the day that there is a child being born, all this process that seemed now seamless on the very last day, it's not. There's a lawyer involved, or several sometimes. There is all these questions: what am I going to do with my embryos that I have left? Or is it going to be, and even, is it going to be a normal child? And I did this and I did that. What should I have done more? So for all of those intents, we like to do our program that is in-house and make it available to you, so that we can go and explain how we're going to do PGS, are we going to do screening, and how is the screening done, what can you do, and what should you do. I quickly want to go, and I went through over all of this, mostly, but I want to make sure that I pass my message along in terms of the advantages. The advantages are simple, clean-cut, very stress-free, because we want to take your stress. We are here to walk through this process and say, we have an egg bank. We use the latest technology for freezing our eggs. It's not an old technology, with people that have been experienced since the very beginning when this technology started to be available, our embryologists. We have programs that establish that, you know, the minimum number of eggs that you will have. Other programs don't, maybe. We have shared programs actually of also for donors. The benefits is also that you can see there is, it is more efficient if you have something that will maybe suffice for one cycle or two, but if you want a second child, for example, you're going to ask yourself, oh, I should have done that. That's a conversation that we should have right in the beginning. It's not only with the first child or with the second child, it's planning ahead your life with us, which is something important for you. Now, why there is another advantage? Well, I know that everybody says we have a lot of experience, but like I told you, Michael, CT Fertility, has started this a little bit more than 20 years ago for gay parenting mostly, and has provided a lot of help even in this group. We have unique plans where we have, and you can go to the website, we have a guarantee you walk unlimited plan, and you walk away with your child. Means you doesn't matter what number of cycles you will have, you've allocated a monetary portion of your life to us, and we'll guarantee that for you. You will go through all of this, and it's available actually in the website, but it's a very important program. You need to have an assurance that we're going to test your baby. If you want to, we can do that. A smaller test, a bigger test, and we'll talk about it. We are also experienced with HIV patients, which is, I think, something relatively important, because sometimes we'll have, some folks that are, and we are experienced with that. It all comes down to the points that you have there. I know that is, all around, everybody keeps on saying the same thing, but if you don't say it, you forgot it. And safety, being empathic with the patient in the worst moments, because there is always a worst moment here and there, and we will help you, guide you through. Now, what you see there is my last slide. These are some of the few components. There's much more than this. But what we want to make with all of this is my click away if it works, which is just streamline. You want to have a baby? We'll make it happen. Thank you for your time.